Hello, everyone. First, I would like to apologize for my voice. I've been sick the past few days, so I've sort of lost my voice, but I can still kind of talk. Basically, the article that I chose to research this week, it's called Comorbidity Profiles of Patients Experiencing Homelessness, a Latent Class Analysis. Um, so it's sort of a more qualitative statistical analysis, but it still includes a lot of the things that we talked about this week. Um, one thing being Z-scores, they use Z-scores in this research. So basically, the study is mainly focusing on homeless people, and different comorbidities that make them have hospital readmission. So it says right here, the study aims to identify distinct comorbidity profiles of homeless patients and to explore the correlates of the identified comorbidity profiles and their impact on hospital readmission. And this is a pretty large study, as we can see, the amount of population of people that was used is 3,445 people. Um, and this was between the years of 2015 to 2019, all in the hospitals called Christina Care. Um, the most prevalent comorbid conditions were tobacco use, 77%, depression, 58%, drug use disorders, 56%, anxiety disorders, 50%, hypertension, 44%, and alcohol use disorders, 43%. And so these were the variables that were sort of put into the analysis. So if we go on to the introduction, it sort of explains how homelessness is such a problem in America, and it also creates a lot of specific health risks for people. Um, Understanding the clustering patterns of comorbidities and their impact on readmissions could help healthcare providers and policymakers devise tailored interventions aimed at improving healthcare outcomes and reducing the acute care utilization burden among patients experiencing homelessness. So that sort of sums up the goal of this article. It's to give healthcare workers and just policymakers more knowledge that can help improve interventions and help keep these people out of the hospitals. So the study design was sort of unique for this since it did end up using um, the latent analysis. It ended up grouping the patient or the participants into four different groups. Um, this algorithm was also used to define the chronic conditions. So that was sort of more on a numeric scale, which is similar to what we've sort of done in class. Um, but conditions like depression, tobacco use, drug disorder, hypertension, alcohol use, even kidney disease, asthma, pulmonary disease, and just like other normal healthcare diseases. So basically, for the statistics, the four categorical variables um, were calculated, and the mean and standard deviation were reported. So that is something that we talked about in class this week as well. And then they used the assumption of confidential independence and latent class explains all the shared variance among the observed variables in the model was evaluated using standard residual z-scores. So basically all of the data for these different variables was put into a standardized z-score and then analyzed from there, which is what we learned in class this week. Um, the most prevalent comorbid conditions were tobacco use, depression, drug disorder, anxiety disorder, and hypertension and alcohol use disorder. And so this is something that made this article interesting to me is that even in a study that's just focusing on homelessness, um, a lot of these people are still being affected by substance use. A lot of drug disorders, a lot of alcohol disorders, and even tobacco use is negatively affecting them. Um, this table shows the variables, all the variables that were assessed, and then the number of people in each group that had each of these variables. And the percents are in this column here. And then the four classes are sort of distinguished, and we can go through them quickly. Class 1 is individuals with very high probability for depression or drug use disorder, alcohol disorder. Class 2 is comprised of relatively healthy individuals that just have other comorbid health conditions. Class 3 is individuals that have a high probability of hypertension and high probability of diabetes. And then class 4 is included 15% in individuals have a very high probability of depression, drug use disorder, hypertension, alcohol use, and just all of the rest of these right here. And we can see all 4 of these groups being compared to each other, with orange being relatively healthy and green being the medically comorbid, which green is the worst. They have the worst outcomes and the fastest hospital readmission because not only are they probably experiencing substance use disorders, they have other health conditions that are comorbid, which makes it really difficult. And here's another table that's very helpful to see this. You can see it medically comorbid here is class 3. It just shows you all the different groups. So yeah, overall, the discussion concludes that identifying of these clusters among patients experiencing homelessness could help healthcare organizations better devise or adopt targeted interventions tailored to subgroups and improve the quality of care delivered to patients experiencing homelessness, with greater financial incentives associated with reducing preventable hospital readmissions. Hospital systems and organizations could better utilize often limited social resources and design different approaches towards discharge planning for higher medical needs patients experiencing homelessness. So basically, this research is helpful because it can give some statistical evidence to healthcare workers and policymakers to improve healthcare of these patients while they're in the hospital in order to reduce readmissions and set them up for as good of health as possible, considering their situations. Thank you guys. If you want to check out more, I'll link the article in my discussion post and you can go read the article if you want.